Good afternoon, everybody. Am I audible?
Good afternoon, ma'am.
Okay. So today we shall be discussing the resolution of the case, okay? How we will resolve the case. And there is no one way to resolve a case, isn't it? This, quite a difficult case and what you call an ethical dilemma. On the one hand, you want to do the best for your patient, okay? The principle of beneficence. That is from the doctor's perspective. But that may conflict with the patient's autonomy because the patient has very clearly expressed her wishes, okay, how she wants to be treated and what she doesn't want to be done to her. Okay, so I have gone through some of your write-ups and I'll just read out some points which are useful for discussion. So one of you has written, there is no document showing that the patient does not want to be under a tube and the doctor has the freedom to save a patient's life in case of emergency. Okay, so I can sense, from your write-ups that you have the sensitivity, the passion and the commitment to do the best for your patients, to be good clinicians. Okay, but sometimes there may be certain legal, social or ethical hurdles or barriers which prevent you from doing your best. Okay, so how do we resolve these issues? How do we resolve these issues and still do the best for our patients? Okay, one of you has mentioned a DNR order, do not resuscitate order, DNAR or DNR. Okay, one of you has mentioned that. And then another student has mentioned the decision-making capacity or the competence of the patient may be in question because of old age, because of her frail health, mental status perhaps is not very sound. Okay, and that can affect her decision-making capacity. That is another issue. And then one of you has written, I shall always save the patient unless there is a document preventing me from doing so, and hence respect her autonomy. Okay, so this is, a very expressive sentence. Okay, very expressive wish. Okay. And then one of you has mentioned a living will, which we'll be discussing today. And someone has also mentioned palliative care or comfort care at the end of life rather than aggressive medical treatment. Okay, so let us move on to two other aspects which may help us to resolve the case and see it from a more holistic point of view. So living will. Okay, one of you mentioned living will. This is called an advance directive. This is a legal document that explains how a patient wants healthcare decisions to be made should he or she be unable to do so. A person expresses in advance. Suppose I anticipate that one day, I'm going to be old, I'm going to be frail, and I'm not going to be able to take my own decisions regarding treatment. I can write in advance. If I were to become sick, if this were to happen to me, these are my wishes. This is what I want to be done. Or this is what I want not to be done. Okay, you express in advance. And this is a legal document. Okay, the statements are made in the presence of a magistrate. Okay, and two witnesses also have to be present to sign the document. This is also legal in India now. The person concerned, the patient, specifies what actions should be taken for their health if they are no longer able to make decisions due to illness or incapacity. So this is called an advance medical directive or advance healthcare directive. Is it clear? Are you able to hear me?
Yes, ma'am.
Okay.
Yes, ma'am.
So this is an example of a healthcare directive. Of course, this is from the US. Okay. This is from the US, where the patient can choose a medical decision maker, that is a surrogate. Okay, suppose I want my daughter or my husband to make medical decisions on my behalf. I can make that choice. Or I can make my own healthcare choices in advance. Okay, should I fall sick or should I fall ill? This is what I want to be done. Okay, so the wishes of the patients are expressed. And this is a legal document, remember. So it can be implemented or it can be acted upon. So this advanced medical directive ensures that people receive medical care which is consistent with their values, their goals and their preferences during serious and chronic illness. And, now that we are going through COVID-19, we don't know when we are going to fall sick or we're going to become ill. Or, we have to come to terms even with mortality, even with death. Okay, so it makes sense to make an advance directive. In the US, they are promoting this now, to make an advance directive, because death can occur at any moment. Illness can happen suddenly and unexpectedly. It is assumed that family will know the wishes of the patient. This is not always true, but it is assumed that the family members are the ones who know the patient best. Okay, so this is an example of an advance directive in the US. Okay, they are called 5 wishes. Okay, so the patient can express, see, my wish. Okay, the person I want to make healthcare decisions for me when I can't. Okay, the person can state the name of the relative or the name of the loved one who is going to make decisions on his or her behalf. The kind of medical treatment I want or don't want, how comfortable I want to be, how I want people to treat me, and what I want my loved ones to know. Okay, so these are the the things which I incorporated in an advance directive. And even if a surrogate is acting on behalf of the patient, the surrogate acts from the patient's perspective. That is, if I'm making decisions on behalf of my mother or my father, I should put myself in my mother's place or father's place. What would my father have wanted if he were able to express himself? If my mother is able to speak for herself, what would she choose or what would she want? Okay, so the surrogate also acts from the patient's perspective. Okay, responsibility of surrogate to respond from the patient's perspective. So this is just an example. Do I trust this person to make decisions based on my wishes? Okay, but legally, I mentioned in the last class, the priority of surrogates is first the spouse. If a person is married, if the patient is married, the first priority of a surrogate is given to the spouse legally. Okay, and then children. Okay, and then after that comes father, mother, brother, sister, and then aunties, uncles, aunts. Okay, but if the physician or the doctor is uncertain about a patient's desires, the default position is usually to treat. Okay, if you're not sure, suppose you're a doctor treating a patient, you're not sure about the patient's wishes and desires. So the default position is to treat. As most of you have mentioned, as a doctor, I would try to save the life of my patient, or I will treat the patient. So legal status of living will or advance directive, it is legal. Okay, the Supreme Court of India on March 9, 2018 permitted living wills and passive euthanasia. So it's very much legal in India as of now. Okay, then there is another entity called do not resuscitate or DNR. Okay, as some of you have mentioned in your write-ups. Do not resuscitate is an order. Okay, it is a written order stating that a person does not want to receive cardiopulmonary resuscitation or CPR if that person's heart stops beating. Now in the hospital, usually when a person goes into cardiac arrest, the default or the action of the doctors and nurses is to resuscitate the patient. We are all trained in basic life support, BLS, and advanced cardiac life support. We are all trained in that. So automatically, without thinking, once a patient arrests, we attempt resuscitation. Okay, but we have to know, we have to be aware that there is such a thing called DNR, and this is an official order. In countries where DNR is not available, the decision is made by the doctor in consultation with patient and family members. Suppose the patient's condition is very frail, very old patient, suffering from a debilitating disease, terminal illness, for which there is no cure. Okay, then DNR is useless. DNR is not helpful or not, it's in no way advantageous. Okay, rather it can do more harm than good if a patient is already suffering. But that is, medical judgment. It is the physician's medical or clinical judgment. Okay, the treating physician has to decide whether this patient can be or this patient can be resuscitated successfully or not. Okay, it is a medical judgment. So in India, we have ICMR guidelines on DNAR. Okay, you know ICMR, isn't it? What is ICMR? Can anybody tell me? We hear about ICMR guidelines, ICMR advisories. Yes?
Indian Council of Medical Research.
Yes, Indian Council of Medical Research. Guidelines on DNAR. Okay. So do not attempt resuscitation is an option. To avoid futile CPR, cardiopulmonary resuscitation, and maintain the dignity of the patient. Okay. The decision is made by the treating physician who is well versed with the patient's condition. And every effort should be made to treat the underlying disease and continue optimal care with compassion. Okay, as one of you has mentioned, palliative care or comfort care at the end of life. That care should continue. Okay, is it clear?
Yes.
Yes, ma'am.
Okay, so this algorithm shows, the current consensus. Okay, this is as per the ICMR guidelines. When should DNAR be done and when should DNAR not be carried out? Okay. So, is the patient at risk of cardiopulmonary arrest in future? If the answer is yes, you have to ask, does CPR have a realistic chance of success? Okay, if the answer is yes, then CPR should be done. Cardiopulmonary resuscitation should be done. But this decision has to be reviewed if the clinical condition of the patient changes. Okay. Now, according to the treating doctor, if CPR does not have a chance of success, or the doctor is not sure whether it will be successful, in debilitated patients, maybe somebody suffering from terminal cancer or, a debilitating illness. So, CPR may not be successful in such a patient. Then you have to ask, is the patient competent to be informed or consulted about DNAR? Okay, you have to assess the patient's mental status, whether that patient is capable of understanding the pros and cons of DNAR, or whether the patient is able to understand what you are telling him, the information you are giving him. Okay, if the answer is yes, then you should discuss. Okay, there's the option of DNAR, do not attempt resuscitation. Should be discussed with sensitivity in simple language by the treating physician with the patient. And patient should receive all information, and patient's choice of DNAR should be respected. Okay, however, CPR, like other medical procedures, is not to be performed on demand. Okay, so the options have to be weighed carefully. Then if the patient is not capable of understanding, the patient's mental status is such that he or she is not able to comprehend the information that you are giving him or her, then DNAR can be discussed with the surrogate, with the patient's relative or the surrogate. Okay, and the surrogate will take a decision, or the surrogate will communicate the patient's wishes and values. Okay, through discussions with family, and a decision arrived in the best interest of the patient. Always, beneficence. Okay, beneficence trumps in this case. Okay, best interest of the patient. And a DNR order is carried out. Do not attempt resuscitation if the patient's heart stops beating. Of course, the final decision lies with the treating physician in the best interest of the patient. You can see here, in the best interest of the patient is everywhere. Okay, so beneficence, the principle of beneficence, in the best interest of the patient. And reasons for the decision should be documented. If the patient or the surrogate declines discussion, this should be documented and review the decision periodically. Okay, in the meantime, okay, as long as the patient is still alive, the heart is still beating, patient is still, can still breathe spontaneously, supportive and compassionate care should be continued. continue supportive and compassionate care. Okay. So these are the guidelines for DNAR in our country, in India. Okay. And there is a form which has to be filled. Okay. One of you, in fact, many of you have mentioned there should be a document, isn't it, stating the patient's wishes. So this DNR is also a document. This DNAR form should be there. Okay. If you're to implement a DNR order, this form should be there. Okay, this document should be there. Otherwise, the default is to perform CPR. If a patient goes into cardiac arrest, if a patient arrests in the hospital, the default is to perform CPR. But if this document is there in the case files and it is signed by the patient and signed by the physician, then the treating doctor can act on this and not resuscitate the patient. Okay, but this is a very important form. It's issued by ICMR. Okay, so name of the patient is stated here. Okay, team of treating physicians finds that in the event of cardiac and respiratory arrest, any attempt at reviving the heart by cardiopulmonary resuscitation or mouth-to-mouth respiration, artificial compression of the heart, artificial ventilation of the lungs, injectable medication and associated measures is not likely to be beneficial and is likely to cause suffering rather than restoration of life of any significant quality. Hence, in the event of cardiac and respiratory arrest, while all appropriate care and treatment to maintain quality and dignity of life will be continued, no attempts at cardiopulmonary resuscitation will be made. So this is very clearly stated. Okay, very clearly stated. And also the decision-making capacity of the patient. Does the patient have capacity to make or willing to and communicate decisions about CPR? Yes or no? Okay, so if the answer is no, then is there a surrogate available to receive information and to discuss DNAR on behalf of the patient? If yes, details of the surrogate, the name and the contact details, and relationship, whether it's the mother or the son or the husband or wife, has to be mentioned here. Okay, so details have been duly explained to the patient and surrogate. Yes or no? Okay, and names of members of the treating team. Okay, it may be a doctor, a single doctor, it may be a team of doctors treating the patient, doctors and nurses who are treating the patient. Okay, and here name of the patient, name of the surrogate, and relation with the patient. Signature. The signatures have to be taken. Date, time, and place have to be mentioned here. Okay, so this form has to be filled completely. Okay, to have value, this form should be filled up completely with all the signatures. Otherwise, it cannot be implemented. So as the doctor, if you see that there's a DNAR form, you have to ensure that it is authentic. Okay, you have to ensure that it is authentic. Okay, similarly, if there is an advance directive, you have to ensure the authenticity of the document. Look at all the signatures, look at, where it is issued from, whether it is from, an appropriate authority who is issuing the document, whether all the signatures are there, all the seals are there. Okay, you have to make sure, that everything is in place, because anybody can produce a fake document. Okay, in this day and age, anybody can produce a fake document. So you have to, before acting on the instructions in the document, you have to ensure that it is authentic. Okay, authenticity of the document has to be ascertained. Is it clear so far?
Yes, ma'am.
Okay.
Yes, ma'am.
So now finally we come to the resolution of the case. Okay, some of you have already resolved the case on your own, isn't it? So as I said, in all these, ethical cases, you don't have a single answer to the question. You may have multiple answers or several answers. Okay, but this is one of the solutions or one of the possible resolutions of this case. Okay, one of the possible ways, one of the many ways you can resolve this case. Okay, so those of you who have written something else, don't say, oh, I may be wrong, I may be, there's no one standard answer. There may be multiple possible solutions. Okay, and the solution may also, take into consideration, as again, many of you have mentioned, the cultural context, okay, the social context. Okay, in the US, it is acceptable for a single person to make a decision. Suppose an old lady has an advance directive which says, I do not want intubation, I do not want to be treated in this manner. It can be carried out. But in India, social ties are very strong in India. And, we give so much attention to family wishes, family values. And in fact, our families become our decision makers, shared autonomy. Okay. Sometimes I find it difficult to take a medical decision for myself. I would consult my husband, I would consult, my parents. Okay. So in India, social ties are strong. So, again, cultural values are different, cultural norms. Okay. So if you compare even US or India, it's very different because of the social and cultural characteristics which are different here. Okay. So this is one of the many possible solutions to this problem. Okay, so how will you resolve the case? You find, okay, in the case of Mrs. Mithili, okay, all of you are familiar with the case now. Okay, so I'm not going to read it out anymore. Okay, Mrs. Mithili. If I were the physician, I would try to find out if an advance directive is available. Okay, is an advance directive available? And ensure the authenticity of that directive. Okay. If yes, if it is available, then I will act on the instructions given. Okay, verbally, Mrs. Mithili may have said so many things like, I don't want intubation, I don't want this, I don't want that. But the problem is, nothing is documented. She has just expressed her wishes, but it has not been documented. Okay, so if an advance directive is not available, then the next step is to look for the surrogate decision maker. Okay, now in this case, the surrogate decision maker is, who is the surrogate decision maker in case of Mrs. Mithili?
Her son.
Her son, yes. See, son may have not lived with her for a long time. He may not know her problems firsthand, but he is still the son. He is still the blood relation. Okay, and legally, he is recognized as the surrogate. Okay, legally, the son is recognized as the surrogate. Whether or not he has fulfilled his, obligation as a son or not, that we don't know. But legally, he is recognized as the surrogate decision maker. Okay, so in this case, the son has very clearly expressed that he wants the doctors to do the best possible for his mother, which means to treat the patient, even if it means intubation, life support, ventilation, even if it means all that. He says, you do what is best, you do whatever you can for my mother. Those are his, wishes. Okay, so the default here is to treat. Okay. Now, if the surrogate decision maker is not available, suppose the son is still in the US, not able to communicate, not able to come to India, even then the default position is to treat. Okay, so in this case, I think the doctors were right in doing what they did, even if it means, intubating, doing whatever possible to save the life of the patient. Okay, so the doctors were right in doing what they did. Okay. But had an advance directive been available, then it would have made all the difference. Okay, if the lady had made a living will, if Mrs. Mithili had made a living will, which is authenticated or which is genuine, then the doctor can act according to the instructions given in the advance directive or the living will, because they reflect the patient's wishes. Isn't it? They are an expression of the patient's autonomy. That is, the ability to make her own decisions regarding what she wants or what she does not want. Okay. But as doctors, we also have to be safe. Even legally, we have to be safe. Now we are caught in so many legal loopholes, isn't it? One of you have written, patients' relatives, will file a case and then there will be so much trouble. How one doctor was beaten up, isn't it? Doctor treating a COVID patient was beaten up because the patients were not happy. with the result. Okay, so such things can happen. Okay, so we have to safeguard ourselves. Okay, we have to be on the safe side. That is why, even though the best thing to do is to treat the patient, but if something like a living will is available, a document is available, then we can act according to the instructions given in the living will. Okay. So is it clear? Does anybody else have any views or any other ways of resolving the case? If you have any other views, you can express yourself. Or any additional points that you want to add? Anybody? Muskan Jain? Muskan Jain is there?
Yes, ma'am.
Yes. So do you have any other views? Any other ways of resolving this case?
Pardon, ma'am?
Do you have any other views on how to resolve this case, or you agree with this?
I agree with this, ma'am.
Okay, okay. Okay, anybody else has any other views? Please feel free, it's okay. I think all of you have written very well, whoever have submitted, no? They have written very well, they have expressed themselves very clearly. And, I could feel the pulse running through you and, that passion that you have for, I think you're going to become good clinicians one day. Okay. Anybody else? Pandap Linra, are you there?
Yes, ma'am.
Yes. Do you have any other possible solutions for this case on how to approach this case?
No, ma'am. I agree with this case resolution.
Okay, okay. Yes, and some of you have mentioned, the skills that we need to have. Yes, you're right. Communication skills, okay, analytical skills, problem-solving skills. Okay, so problem-solving skills and decision-making skills, these are hard skills, but communication is a soft skill. Okay, communication is a soft skill, just like empathy and compassion. These are soft skills. Yes, Mayuri Roy, are you there? Mayuri Roy? Yes, do you agree with this case resolution or you have any other views?
Ma'am, I agree with the case resolution.
Okay. Regam Marak?
Yes, ma'am.
Yes, do you agree with this or you have some other views?
I agree with this, ma'am, the resolution.
Okay. Ruth Lombi, are you there? Ruth Lombi? Pradipta Saha? Pradipta, are you there?
Yes, ma'am.
Do you agree or you have anything to add?
Ma'am, I agree with you.
Okay. See, you're free to disagree also in case you have, some other solution or some other approach to the problem. I mean, you can discuss it, okay? Okay, so fine. I take it all of you agree with this. If anybody has any other views, please feel free to express, okay? Or if you have another way to approach this problem, maybe after reading some more or after understanding some more concepts, you find a different approach to solving this problem, then please feel free to discuss it. Okay, we can all learn from your experience. Okay? So
Okay, ma'am.
Okay. So the key points, okay, the issues, because one of the questions was identify the medical, legal, ethical and social issues in this case scenario. Okay, so just briefly I've written, you can add some more if you can identify any other, you can add. Okay, so legal issues, informed consent. Okay, informed consent and advance directive. These are legal issues. Okay, ethical issues like patient autonomy and beneficence, which we have discussed at length. Social issues like family wishes and then social support. Okay, I think more than one of you have mentioned that, the son should not have left the mother all alone. She has no social support. Okay, so social support, family wishes, these are social issues. And also the doctor-patient relationship. Okay, and even the relationship between the mother and the son, some of you have mentioned. Okay, there should have been a closer relationship between the mother and the son. So, the relationship within the family also. And how much do family wishes count? Do you give a lot of importance to family wishes or, it can be overruled sometimes? Okay, so that also depends on the situation. Okay, so any other issues that you can possibly add here and here? Any other legal issues, any other ethical issues? Anybody? Do you want to add some more? I think all of you have done a good job writing the assignment, especially those of you who have written in the first person. Like, if I were the doctor, I would do this, I would do that. That gives a very, what should I say? A very personal approach to the problem. Okay, I would save the life of the patient. I would do my best. I would, you express your aspirations, your wishes, what you would have done. Okay, so that is very meaningful. Okay, to put yourself in the, in the place of the doctor. If you were the doctor treating that patient, what would you do? Okay, so it makes a lot of sense if you write in the first person. Okay, it gives a very personal approach to the problem. Anything else, anybody? Would you like to add anything else?
No,
Grace?
ma'am.
Okay. Okay, so thank you very much. Thank you
Thank you,
very
ma'am.
much. That is all for today.
Thank you, ma'am.
Thank you, ma'am.
Thank you.